what guidance can be given to people about home hygiene? I think what's really important for people to know is that this coronavirus is actually very similar to the normal viruses that cause colds and flu. And that's why the information that we're emphasizing is information that we teach to our children and that we practice every day. Really the mainstay of protecting yourself against this virus and any respiratory viral infection, and in fact bacterial infections as well, is hand washing. So the most important thing is to wash your hands frequently for 20 seconds with soap and water. And the reason why hand washing is so important is that the main way this virus gets to us is through our hands touching surfaces or other people that do have the virus on them, and then bringing it up to our nose and mouth, where it can enter our body through our nose, our mouth, or our eyes. There's the so-called mucous membranes, which are the wet surfaces of the body. So hand washing is really the key. But there are other things that we can do in terms of hygiene. So if somebody is sick in the house, they need to practice what we call cough and sneeze hygiene, which means coughing into your elbow, not coughing onto your hands, because hands are how we spread the virus. And then making sure that if you are using tissues, that those are really well disposed of carefully, and that you dispose of them yourself, because anybody else who touches those obviously could have a high risk of contaminating themselves with the virus. If at all possible, if you're sick, you should really try to stay 1 meter away from everybody else. And the reason for this is that along with our hands and contact, the other way the virus spreads is through droplets, which are the droplets that are released from our mouth when we cough and sneeze and talk. And these viruses can travel up to 1 meter. So as much as possible, people should try to stay 1 meter from you so that they don't have these viruses potentially landing on their face and causing an infection. Now this can be difficult in a crowded setting, and so what we're really recommending is, as much as possible within what you're able to do in the living situation that you're in, to try to separate yourself. And for example, people who could have the infection are advised to sleep separately from others, if possible in a separate room. But if it's not possible to sleep in a separate room, at least try during that sick period not to share a bed with others. Other general measures like ventilation. We're very lucky we live in a warm climate generally, and still not really into the winter season yet. So keeping your windows open and allowing good ventilation in the household is again good for all kinds of colds and flu, and basic sunlight and fresh air, I think, is always good for reducing the virus spread. In terms of hygiene and cleaning in the home, what's really important to know is that cleaning surfaces with normal soap and water, the way we do for our routine cleaning, is effective in getting rid of the virus. And so really just making sure that you clean the surfaces in the house, which could become contaminated by people, can also be very helpful to reduce any possible load of a virus that could build up on the surfaces.
If you develop symptoms of respiratory illness, including a cough, fever, and shortness of breath, you must seek medical care early. It's important to call your doctor first, self-isolate, and advise on your travel and contact history. If you would like to know more on anything relating to COVID-19, call the General Public Hotline at the National Institute of Communicable Diseases on 0800 029 999, as well as 0800 111 132, or log on to www.nicd.ac.za.